Hello, Grace. Thank you for coming in today.
Well, I'm really mad I have to be here. I have a lot to do and do not have time to be talking to you.
I'm sure you're very busy, and I really appreciate you taking the time out to come here and talk with me.
And who are you anyways exactly? You know my name and I don't know anything about you.
Okay, that's understandable. Allow me to introduce myself. My name is Miss Peters. I graduated from the University of Houston with my master's degree in social work. I'm a licensed master social worker here at the Child Protective Agency. Are you familiar with social workers or social work or Child Protective Agency? It's also called CPS.
CPS? Yes, I know what you social workers do here. You take people's kids away, like you're trying to take mine away. Is this why I'm here?
Well, my job here is to ensure that children are safe and help families take the right steps and have the correct tools to ensure that. So as a social worker, I'm a case manager and I meet with several families throughout the week and help guide them and let them make better decisions. So you're here today, Miss Grace, because there have been concerns regarding your drug use and partying, and it's been caused to maybe interfere with your ability to take care of your children. And you've also recently tested positive for cocaine. So before I ask you a little bit more about that, I'm going to go over confidentiality with you. So whatever we talk about today is going to remain with us. I'm not going to release any of those notes or records to anybody. But there are a couple of exceptions. So the first one is if you're going to hurt someone. If you threaten to hurt someone, or you're hurting yourself, or someone's hurting you. So if any of that happens, I kind of have to step in and get the right people to come help you. Okay, does that make sense?
Sure.
Okay, and then the other one is if a court order. So if a court subpoenas my records, I have to give them, and I have to allow them to look through them for court purposes. Okay?
Okay, is my mom going to see this?
No. The only way your mom would see this is if you signed informed consent for her to be able to read these or to know about any of this. Okay?
All right.
All right. So can you tell me a little bit more about the fact that you tested positive for cocaine?
Look, I told the last person I don't use drugs. Someone spiked my drink at that party. So I guess it was cocaine. And when I took that drug test, it must have still been in my system. And I need to party sometimes. I have 3 kids, and I take care of my mom. She's disabled and has been for a couple of years. I just need to relax and have some fun, and that's what I like to do.
Okay, I imagine the stress of being a mother of 3 and taking care of your mom is very hard for you. It's understandable to want to relax sometimes. So why don't you tell me about yourself? I mean, like, what do you like to do, or what does a normal day look like for you?
Well, I'm currently in between jobs right now. I used to work for the Marriott, but they weren't flexible enough when my mom got sick. Before my girls were at my aunt's, I would wake up at 7 to get them to school at 8:30. The younger girls go to the same elementary school, so I take them. Dominique likes to take the bus with her friends. Then I just help my mom bathe and get her food and such. Sometimes I try to find another job, but that gets so frustrating at times. I only get child support for my youngest, and paying the rent and electricity seems to be getting harder and harder. I usually pick up the girls around 2:30, and Dominique gets home around 3:45. I usually help them with their homework if they have it, and then start dinner around 5. After that, we usually have some family time and watch a movie or something.
Well, you have a lot on your plate, it seems. I mean, juggling everything and keeping track of everyone must be very intense for you at times. So tell me what it looks like when you go out to a party at night.
Well, I usually have my aunt come over to watch them if I go out. The girls are usually all in bed by 9 or 10, so I leave after I put them to sleep. My mom also keeps an eye on or an ear on them if I decide to go out. But I never leave them alone.
What happens if your mom or if your aunt can't come over?
I just don't go out. My kids always come first.
All right, well, why don't you tell me more about your children?
I have 3 girls. The oldest, Dominique, is 13, Danielle is 10, and Veronica, my baby, is 9. They are so smart and are doing so well in school. I am so proud of them. I really miss them. None of us understand why they have to live at my aunt's.
You really love and miss your children, Grace, and That leads me to kind of explain what the rest of the session will look like. Like I said earlier, it's my job to ensure that children are safe and that you kind of have the tools to ensure that. But before we do any of that, I'm going to ask you, if you don't mind, several detailed questions about you, your children, the alleged incident which is why we're here today. Is that okay with you?
I guess that's okay.
Okay.
Grace, can you tell me if in the past 2 weeks you have been interested in doing any of your favorite hobbies or pastimes?
Well, I like to paint, but I haven't in a while, actually.
Why haven't you been painting lately? Have you been feeling down or depressed?
I just haven't really felt like painting. I've been really moody and haven't really felt like being with other people. And I guess I feel kind of isolated, especially since you guys took my girls away from me.
I can only imagine how not having your girls around you makes you feel. Are you feeling angry or irritated with this?
Yeah, I'm furious at my aunt for calling CPS. It was just way out of line.
Why do you think your aunt called CPS?
I don't know. She said I leave my girls to go party. But I don't. I've never done that.
Do you get home on time to get enough sleep? How many hours do you think you sleep every night?
5 hours, I guess. I mean, sometimes only 3 or 4 maybe. But I do okay. I manage.
Have you been feeling restless?
Like not knowing what to do with myself? If that's what you mean, yeah, I'm jumping now that you mention it.
Can you describe what that feels like?
I don't know. It kind of comes in waves. Like, after I go to a party and I'm with my friends, I feel great. I feel like I can do anything. But then I come home and I get really, really tired.
In addition to being tired, have you noticed anything else?
Well, I guess around a month ago, I have started to notice that my pants kind of hang on me a bit. I mean, I don't weigh myself regularly or anything, so I can't give you a number or anything like that.
Just so I have this right, you've been feeling tired when you get home, and you've been losing some weight?
Yeah, that's right.
Do you ever get any aches, chills, or nosebleeds?
No, I feel pretty good most of the time.
Do you ever feel like hurting yourself or others?
Oh my gosh, no, I could never hurt anyone, especially my girls.
So in general, you've been feeling all right, except for the jumpiness and frustration, which you have attributed to your girls being taken away from you. I would like to ask some questions about your family now. What are some of the things that you like to do with your girls?
Well, we like to do all kinds of fun stuff. I mean, lately our thing is to kind of watch movies and, get popcorn and snacks. Danielle and Veronica like to play video games, so sometimes I play with them, but Dominique doesn't really like them. I guess she's too old for that.
How often do you see your daughters now?
Twice a week, and it's just not enough.
Transitioning from seeing your girls every day to twice a week must be difficult. How would you describe your relationship with your aunt?
Well, I mean, we get along. She's always there for me and the girls. But right now, she's just making me so mad. She blames all of this on me, saying it's my fault because I'm out partying, doing cocaine. It's a huge lie, though. I wish she would just butt out of my business.
Is your aunt usually involved in your business?
Not usually, but lately she sure has been, especially now.
How's the relationship between your girls and your aunt?
Well, I mean, they love her. She is their aunt, but they don't want to be living with her. They miss me. They need to live with me. I'm their mom.
So you and your girls must have a very strong and special bond.
They're my babies. I'm a good mom. I do the best I can. And they're doing so well in school. All 3 of them have straight A's and perfect attendance. I don't know why we're not living together.
Do you have any other family members in town?
I have 2 brothers that live across town. One's older and one's younger.
How often do you see your brothers?
A few times a month, I guess. Sometimes I invite them all over, and me and my mom and the girls and my sister, or my aunt, all have dinner.
Right. I know you have been the primary caregiver for your mother. If you don't mind me asking, what is her medical condition exactly?
Well, she's got many complications. Firstly, she's diabetic, and then she's also on dialysis. She just gets so weak, and it's hard for her to walk sometimes.
You're very strong to be taking care of your mother during this time.
Thank you.
Well, Grace, it looks like we're running out of time for today. During the next session, I would like to go over the plan that I mentioned at the beginning of our session today.
That sounds good, but what will we be talking about?
Well, as you know, the department has set out certain things that need to be done in order for you to be reunited with your girls. There are certain things that need to be done as well that will create a safe environment for your girls to thrive in.
My girls do have a safe environment, though.
Yes, you provide for them and care for them, and like you said, they are doing well in school. However, we need to address the concern of drug use and leaving your girls unattended at home.
Fine. I guess we can talk about that, even though I've never done any of those things.
All right, how does Friday at 1:30 sound?
Sure.
Hi Grace, it's great to see you again. How have you been since the last time we met?
Hi. Yeah, I've been a little better. Just trying to be better for my girls and helping my mom out, of course.
That's good to hear. Have you been able to see your girls still?
Yeah, I see them a little more than I was, and they're still doing great, but they still miss me, and I still miss them, and we just really want to be united again.
Right. I can only imagine how that must feel for y'all. It sounds like y'all want the same thing.
Yeah, definitely. Is that what we're going to talk about today?
Yeah, thank you for bringing that up. As you know, the department has set out certain standards that they want met before the girls can be back in your care and before you can, I guess, regain permanent custody of them from your aunt. And those things include the drug counseling cessation classes. It includes the family plan that allows for someone to be in the home while you are out of the home, so no more leaving them alone. Essentially, they want to make sure that your home is a safe environment for your girls to thrive in.
My home has always been a safe place for the girls to thrive in.
Right. Well, you do provide for them, and you love them, and you care for them, but there is still the concern of the drug use and leaving your girls unattended.
All right, I understand.
Okay. Well, how did the eco map go from last week?
It turned out really well, actually. Like, seeing it all in picture form, I realized a lot of things I guess I really didn't know before.
And what are those things? What'd you learn?
Well, for one, partying is actually really negative for my girls. Even though it's stress relieving and fun for me, it means leaving them at home when they really shouldn't be left at home.
Right. So is that something you were doing frequently?
Yeah, it was. It's just something I really didn't want to admit to myself or to anyone else, but I was.
Well, it's good that you're admitting it now. Was there anything else that you learned?
Well, that my friends that I party with really aren't the best influences. I mean, I still like them and they're fun to be with, but maybe it's just not the best thing. Maybe I shouldn't hang out with them anymore.
Right. So partying with these particular people and staying out late, you see as negative things for your girls and
Yeah,
yourself.
definitely. I mean, I know I need to stop hanging out with them.
Right. Well, that's good that you're realizing that and you're admitting that. Were there any positive aspects that you identified?
Yeah, my aunt is very helpful. I mean, she does so much for me and the girls, and even though I'm really annoyed with her right now, still, she's always there for me and the girls, and I think she always will be.
Right. So she's a good support system for y'all.
She really is, and I know if I just asked, she would stay with my girls when I'm not at home, and I feel like I'm a burden on her, so maybe that's why I don't ask her as much, especially since she'd be staying with my mom, too.
Right. So has she ever vocalized or acted as if you were a burden on her?
Well, now that I think about it, I guess not. Usually she volunteers to help out with the girls. I mean, she loves to take them places and to watch them, I guess.
Right. Well, I know sometimes it's hard to ask for help. You don't want to, like you said, be a burden on the other person. But if you have this strong support system, available to you, that would be a good thing to utilize. If you're willing, and if she's willing. But it sounds like she is.
Yeah, for sure.
So there's another thing I wanted to talk to you about. I see here on the CPS report that you tested positive for cocaine. Let's talk about that.
Right. About that. I know that I denied it before, but I was using drugs with those friends that I talked about earlier.
Well, that's a big step towards getting your girls back into your care permanently, which is your end goal, as you stated. And as you know, the reunification contract does mandate drug counseling classes. So how do you feel about that?
I want to do whatever it takes to get my girls back, and I know I have to do that, but I think it's just going to be difficult with having to take care of my mom. And honestly, the stress is probably why I did drugs to begin with.
So what stresses you out?
I mean, taking care of the girls and taking care of my mom and just not really having any time for me. I guess that's it.
Well, stress can cause us to do, positive and negative things. So perhaps if you're interested, we could talk about different ways to cope with your stress. And if you're interested, possible assistance in the home for you to alleviate some of that pressure that you're feeling.
Okay. Yeah, I really appreciate that. I was actually going to bring up that today. Maybe someone to help me with my mom.
Right. So what would that assistance look like?
Well, I mean, just someone to come in and help her with baths and maybe clean every once in a while with, I don't know, just to look after her, I guess. Just to take a little bit of the pressure off of me.
Right. All right. Well, Grace, it looks like we're about done for the day. But what I like to do is to continue to explore these potential plans and, of course, the two important ones that the reunification contract outlines. Does the same time next week work for you?
Yeah, that sounds great. Hi, Grace. It's good to see you. How are you?
I'm doing good.
That's good. Well, the last time we met, we talked about various steps to work towards and complete to reunify you and your daughters. Do you remember those steps?
Yeah, I remember the reunification contract and all of that.
Okay. So the first thing I would like to go over with you is your compliance with Narcotics Anonymous. How has that been over the past 6 months?
It was a little tough at first.
Okay, how so?
It was just hard to accept that I had a drug problem. All of my friends did drugs and drank and partied, and to them it seemed like they had it together still.
Yeah.
So for me to have my girls taken away and realize that maybe I don't have it together was difficult, but once I got over that, it was easier for me to attend classes and kind of accept it.
Well, first I would like to congratulate you for sticking with the courses and not giving up because, like you said, it is hard. And yeah, it is tough to actually acknowledge a lot of changes that we want to make, and sometimes change isn't good, but sometimes it's needed. And the fact that you actually stuck with it and finished it, that's a really good accomplishment, and you should be really proud of yourself.
Thank you.
You took a big step in accepting those changes. So one part of the reunification contract was that for you to attend Narcotics Anonymous for a span of 6 months. And as I am reviewing your attendance record, it seems that you have done just that. And again, I'm very happy to have had your compliance with this. I know it wasn't hard. It wasn't easy, sorry.
Yeah, it was tough, but I feel much better now, and those classes really helped, and I think just being in it with other people who are either in my same situation or have been, like my sponsor, actually went through something similar, and so it was helpful to have people on my side, I guess.
Yeah, I'm glad you say that they've helped you. Again, it is really tough, and I know sometimes it's easier when we go through experiences with another person that's been through that same experience.
Yeah.
So it's easier to have that support group with you. So now I would like to talk about any new support systems. I recall the last time we met, you said you were a bit isolated, especially after losing custody of your girls. Have you been more involved with the community or any other organizations lately?
Yeah, I remember that. I actually joined a book club in my neighborhood. At first I was nervous about meeting new people. It was a lot of older women, but the group is amazing and they're all very accepting and nice. They welcome me with open arms, and I feel like they've kind of become a second family to me.
That's awesome. That's really good to hear. I'm glad you took this step, and trying something new, because it could be really hard to try something new. And especially if you're just reaching out to them by yourself, that's really good that you got along with them, and it only increases your chances of any moral support in the near future. And again, friends are always a nice thing to have close to you.
Yeah, I definitely don't feel as stressed anymore. I mean,
Mhm.
I have my moments, but I feel like I deal with them better, and I know that I can count on these women to help me if I need anything.
Yeah, that's good. It's always good to, as long as you know, like there's people there willing to catch you. You know, if you
Mhm.
fall or just hear you out. It's always good to talk stuff out that
Yeah.
you don't hold it in. So I know before you were really concerned about your daughters, and I know visitation wasn't always easy for you. How has that been in the last 6 months?
Well, it's easier. My daughters are still doing well. They're in school, but they still miss me, and we're all just ready to be together again for good.
That's good. I understand it must have been tough having to adjust to those changes, you know, because again, change isn't good, and I can only imagine it wasn't really tough on you, but it probably was tough on your daughters. You know, they all grew up with you in the home. But the fact that you consistently visited them says a lot about your role as a parent and how much you love your daughters, and that's a good thing.
Yeah, I love them very much.
Yeah. We also mentioned in-home care for your mother to alleviate stress. How has that been?
It's been much better. I'm not feeling as agitated as I was. I definitely have more patience with her, and finding more time for myself has been a big thing. Having someone come in and look after my mom has helped me enough to where I'm able to find a job and actually have a full-time job now.
Okay, that's awesome. I actually wanted to talk to you today about employment as well. I'm glad to hear that you're feeling less stressful and that you actually made the step to look for a job. How has that been?
Yeah, I love working. I actually forgot how much I liked to work. Kind of reminds me of when I worked at the Marriott. It helps me stay focused and not party as much and just, focus on the good things.
Yeah, I hope you keep up with all the changes you've made so far because it's definitely been changing for the better. You know, you made a lot of positive changes. And I hope it doesn't stop here even after the reunification plan is up.
Right. So, does this mean I'll be able to have my daughters back?
Well, not exactly. See, I'm really not in charge of that. The ultimate decision is up to the judge to make that decision. But what I could do for you is just recommend positive recommendations, definitely, after what I'm hearing and looking at your progress. You've made some positive changes, so I will recommend that to the judge, but I do not have the ultimate say if you guys will be reunified or not. Do you understand that?
Yeah, that makes sense. I just hope it all works out.
Yeah, definitely stay positive, and I mean, despite the outcomes, you should reflect back at how far you've come so far and all the positive changes you have made in your life, no matter what happens.
Thank you.
Yeah, and it was nice working with you, Grace. Thank you for opening up to me and being so brave to disclose various things. I wish you luck.
Thank you. And thanks for being patient with me. And no, I wasn't always the easiest. And working with me, and it was nice to have you on my side.
And definitely, if you ever need to come back, you know that we're here for you in CPS. We're not here to take your children away, but we're here to actually help you guys and try to give you guys what the resources you'll need to be a whole family again.
Thank you.